Hi there, my name is Allie Klein. I'm a nursing student at Lambton College. What's your name and date of birth?
Fred Klein, April 28, 1973.
Okay, and I just want to check your wristband to make sure it's the same. Okay, and what's your reason for coming in today?
I have a pain in my lower abdomen.
Okay, have you had any other gastrointestinal problems, any Crohn's disease, constipation?
No,
No? And have you had any family history of any abdominal cancers or any gallbladder diseases?
No.
Or anything like that?
No.
Okay. So when did the pain start?
probably about 2 days ago.
2 days ago. And is there anything that you've tried to make it better?
Not really.
No. So there's nothing that makes it better or worse?
No, it's just throbbing pain.
Okay. Is there anything that brings it on?
No, it's just always sort of there.
Okay. And can you describe how it feels? Is it burning? Is it stinging? Is it stabbing?
It's just like a piercing pain.
A piercing pain, okay. And can you point to where it hurts? Is it the pain traveling anywhere, or is
Right
it in the same
this
spot?
area right in here.
And it doesn't travel anywhere?
No.
No. Okay, and on a scale of 1 to 10, 10 being the worst pain you could imagine, how would you rate your pain?
Probably about an 8.
An 8, okay. And is this the first time you've ever experienced this?
Yes.
Okay. And you said it's kind of just constant, it's always in the
Yeah.
same spot. Okay. So, to your understanding, what do you think this might be?
I think it might be.
So, to your understanding, what do you think this might be?
I think it might be my appendix.
Okay. And do you have any other associated symptoms? Any nausea, vomiting, diarrhea?
I feel a bit nauseous.
Nauseous? Okay. So are you on any herbal medications, over-the-counters, any prescription medications?
No.
Okay. And do you have any allergies to any medications, foods, or allergens?
Septra.
Septra? Okay. And how is your diet? Do you eat a balanced diet?
I eat a balanced diet, yeah.
Okay. Can you tell me what you've have you had like your normal diet in the past 24 hours?
Yeah, I've been
Have you
eating.
eaten anything different?
No.
Okay. And how many alcoholic beverages do you drink in a week?
Maybe 1 or 2.
Okay. And do you use any illicit drugs?
No.
Okay. And do you smoke?
No.
When was your last physical exam?
About a year ago.
Okay. And have you had a colonoscopy recently?
No.
Okay. And are all your immunizations up to date?
Yes.
Okay. And how many hours a week would you say you exercise?
4 or 5.
Okay. And how would you say your stress is? Your stress levels?
I'm not too understressed. I'm not stressed.
Okay. And do you have any food intolerances, gluten, lactose?
No.
No? Okay. And do you have regular bowel movements?
Yeah.
Okay. And they're like a normal consistency, not
Yep.
too runny or...
Yep.
Okay. Is there any bleeding in your stool?
No.
Okay. And you don't use any laxatives?
No.
Okay. Are you urinating regularly?
Yep.
Okay. And it's just a pale yellow color?
Yes.
Okay. And because violence is so prevalent in today's society, we have to ask everyone this question. Is there anyone you're afraid of?
No.
Okay. Okay. So I can see that you seem to have a little bit of pain there in your abdomen. You don't seem pale though, and you seem fairly comfortable there laying down. So I'm just going to start by doing a bit of a physical exam here. Do you need to go to the bathroom before we start? Because I might be pushing around on your
No,
abdomen.
I'm fine.
Okay.
Thank you.
So I'm just going to get you to bend your knees up a bit. That's good. And I'm just going to lift your shirt up. Okay. So I'm just going to inspect here. So you have some freckles and some moles. You have some hair. I can see a little bit of a palpitation from your abdominal aorta. You have a flat contour. So that's all normal. So now I'm just going to do some auscultation. So I'm just going to listen to your stomach here to see if I can hear anything going on. Okay, so I heard vowel sounds in all 4 quadrants, which means that you don't have any blockages or any constipation, which is all normal. And if I couldn't hear any vowel sounds, I would have to listen for 5 minutes to determine if there's no vowel activity. So now I'm just going to do some percussion. So now I'm just going to do some percussion on your abdomen. So I'm just going to listen here.
That's about where it's sore.
Right there?
Right there.
Okay. Alright, so I heard timpani over all the areas. So that's a normal sound for me to hear when I'm percussing over your abdomen. Now I'm just going to percuss over your liver and your spleen just to make sure they're not enlarged. Okay, so your liver should be between 6 and 12 centimeters, but I didn't hear any dullness there, so that's not enlarged. And your spleen should not be palpable, and I didn't hear any dullness there either, so neither your liver or your spleen are enlarged. So now I'm just going to do some, palpation. So I'm just going to first start with some light palpation, just feel around. And let me know if you feel any tenderness.
Right there.
Okay.
Right in that area.
Okay. So I didn't feel any masses there, which is all good. You reported some tenderness there in your right lower quadrant. But we will do some deep palpation now just to feel a bit better. So I'm just gonna, let me know if you have any pain.
Right, yeah, right there.
Okay. Okay, so again, I didn't feel any masses, but you did report some tenderness there. So now my last test, I'm just going to do the Blumberg test, which is a rebound tenderness test. So what I'm going to do is I'm going to put my hand down and onto into your abdomen here on the side, and when I pull it up, just let me know if there's any tenderness. Okay, so just take a deep breath. Was there any pain there?
No.
No? Okay, so that's normal. So if you had felt pain there, that would have been an indication that you have some inflammation in your abdomen. So
Okay.
we're done with the physical exam there. So now I just, we like to give some relevant health teaching. So you said you had a good diet, which is something you can keep up. You can follow Canada's food guide to keep your diet balanced with all the right food groups. Exercise is important for your abdominal health, to keep things moving in your abdomen. So we suggest doing a little bit of exercise every day. And then again, just keeping up with your checkups, and as you get to a certain age, you need to be getting colonoscopies regularly just to keep your bowels in healthy shape. So I think that's everything. Do you have any questions for me?
No, you've been very thorough.
Okay, so I will report to the doctor that you have some pain there, and you think it might be appendicitis, and it was nice to meet you.
Nice to meet you too.
Okay.